Okay. I've announced that we are live. Hopefully more people will join us. Please confirm that you can hear me, you can see me clearly. Is my chair here? Where is everyone? We need to get the district governor so that they can be on the call. Hello? My Rotarian, Afolashade Akisoya, welcome. I celebrate you, Ma. I celebrate you. I celebrate you. I'm waiting for the president, for our chair. She's not here. I don't know if our guest speaker today is here. I was asking in the comments, what are our expectations today from today's webinar?
Hello,
What
Mercy.
are
Good afternoon. Yeah, my name is
Good afternoon, sir.
My name is
Okay.
Ogudipe, and I am the guest speaker for today. So I've been waiting. I was the first to be onto the platform.
Oh,
I'll join
thank
you
you,
when
sir.
others are ready.
Thank you so much for your patience. I just called the chair because she needs to be here and the district governor.
MGI.
Ma?
Have you gotten through to the chair?
I just called everybody in the subcommittee.
Okay.
I called. Hey, Joshua,
I will try and get her on
please,
my
can you
other
help
line
me
too.
call her? Yes,
I'm
thank you,
calling
ma.
her now.
I'm grateful, ma. Eshego. Thank you so much, ma. Our guest speaker is here. Please, Rotary and Elizabeth, is it possible to help us call the DG to notify him that the webinar has started? I don't know if you are still in the office. Let me put this on my tripod stand. Okay. Welcome again. Welcome again. As I see, I'm going to call you. Thank you for joining. The number is growing. Let me just do another broadcast as we wait. Rotarian Grace, thank you for joining. Rotarian Sandra, thank you for joining. Please mute your device. Mute your device. I'm not sure who is calling the DG, but once the chair comes in, we'll probably start. Thank you so much. Please, another moment. Wish I can play music in the background so that we can
The
all.
chair is joining in a bit. She's just having problem with her network. She's joining in a bit, please.
Thank you so much, ma. Thank you.
You're welcome. Thank you, my queen.
Okay. Another jolly good afternoon to you. I hope you had a good holiday, everyone. I hope your holiday was great. I hope you got to rest. Even despite going for Salah meet. How many of us went for Salah meet? If you went for Salah meet, type meet in the comment section. Did you go for Salah meet, or are you the one that hosted? Did you go to be hosted, or are you the one that went to be hosted? Good afternoon, Rotarian Peace from RC Festa. Can I know where you are joining us from? Can I know where you are joining us from so I can shout it out for you guys? And my name is Mercy Georgie Gafe. I'm joining from Rotary Club of Omole Golden, the only golden club, very golden club indeed. There's no any other golden club is not as golden as Omole. Please, where are you joining us from? Can you type your name, the name of your club? Are we all from District 9111 or from another district? Please, if you're on the call, let's make this place active. Yeah. Thank you, Rotarian Grace. Ah, Rotarian Grace from Omole Golden. That's my golden sister, my very golden sister. Good to have you on the call, Rotarian Grace. Thank you so much for joining. I'm super excited to have you on the call tonight. Who else? Where are we joining from? Where are we joining from? Are you in Lagos? Are you outside of the country? Let me do another broadcast so that I can tell everyone that we are live. Where are you joining us from, please? Where are we joining from today? Thank you, Roteranjaya Simi. Thank you for joining. Thank you so much for joining us. There's a chair on the call now. Our guest speaker has been waiting. PAG Bassi. Oh, my chief of staff. Thank you. It's good to have you on the call. PAG. Okay, my glasses is deceiving me. My beautiful sister from another mother, Rotarian Oyinilola Saleh. The ever working, hard working, beautiful, beautiful, beautiful woman with a beautiful soul. I celebrate you, Rotean Oyinilola Saleh. Finally, the chairman is here. The chairman is here. I greet you all. Good evening from wherever you are. If you are all from Nigeria, good evening. If you are not all from Nigeria, still good evening. What can I say? Okay, and welcome to today's webinar, which is going to be focused on a topic that is not often discussed. The topic is hypertension, the silent killer. We must not ignore. We know. Do you know the numbers? What are you dealing with? High blood, low blood? We have a professional that will be speaking to us today. My Rotarian president, I celebrate you from Rotary Club of Akomojo, one of the amazing united presidents that I've come to love and sincerely appreciate. I celebrate you. Welcome tonight. Welcome tonight. Welcome, Rotarian Olufemi Oluide. In case I didn't see you, please drop a comment in the chat. I was trying to read people's comments where you are joining from, but I'm not getting a lot of responses. What's the name of your club? What's the name of your club? So, without further ado, I'm going to call on our chairperson. I don't know if we're going to wait. Okay, Infinite Note 11. This is Rotarian Olori Yeye Bisayo Olori Yeye Bisayo Oyekan Oguleji. This is the United President from Abeokuta, Rotary Club of Abeokuta. I celebrate you, Ma. Although your phone is reading infinite, I celebrate you. You're an amazing Rotarian. I celebrate you. Please, if you want me to shout you out, let me know, and I will be more than honored to do that. Put your comments in the chat, and that will be done. Madam Chair, I think we can kickstart because the DG is not here. I don't know if you want to reach out to him. My chair.
Okay, yes, please.
Okay, should we go ahead to start?
Yes, ma'am. Yes, ma'am.
Okay, so without further ado, I'd like to bring up Mami. I'd like to bring up a woman that I've come. I met her first time. I just saw her passion for Rotary. She's overly passionate, overly, like we are. And sometimes, anyway, I celebrate you, Ma. Without further ado, the woman that has been in charge of the women in Rotary for the last 3 years. I mean, for the last 2 years. I think we have 1 more year to go. And none other than my chair, past president, Rotarian Omolara. Hello, my chair, are you there?
I am here, please. I am here.
You have the virtual floor. Elizabeth, please, have you started recording? Are you started recording, please? I don't know if she's still there.
I am here. I'm here.
Rotarian Elizabeth, have you started streaming? I'll try and call her. Ma, you have the virtual floor, ma. The floor is all yours.
Thank you very much. My coordinator, Rotarian MGI, all Rotarians, board, family and friends. And I also want to say a very big thank you to our speaker for today. Thank you so much, sir. You are well appreciated. And to all Rotarians, please, we can call up all our friends to please join this awesome topic we are treating today. It is very, very important for us to learn. And I'm sure that none of us will leave this platform without getting one or two things to do about hypertension. So please let us listen carefully and enjoy the webinar. Thank you, MGI. Thank you, our speaker. Thank you, all participants on this program. As we open up this webinar, thank you so much. Over to you, MGI.
Okay, sorry. I was speaking. I didn't realize I was muted. My chair, I think we should start. Maybe we should start off with the Rotary Grace, ma, before I call on the speaker so I can introduce him.
Okay. Can we all please share the Rotary Grace? My DG, sir, we are waiting for you on our webinar, sir, just to open it for us. Just 2, 3, 5 minutes, sir. That will be fine, sir. Thank you.
Okay, is the DG coming in?
Yes, it's very shortly now. He's going to
Okay,
join us.
thank you so much.
So
Yes.
let's quickly say the Rotary Grace. At the count of 2, 1, 2, go.
Okay.
Oh,
Oh Lord, and giver of all good, we praise thee for our daily food. May Rotary friends and Rotary way help us to smile in your land.
Thank you very much. Thank you so much.
Thank you. Thank you, my chair. Is our DJ here before I start with the bio of the guest?
They will join us shortly, ma'am.
Okay. So let me go ahead to take the bio of the guest because we're already 18 minutes into the time. We thank you. This is going to be an experience that we all take away. It's a topic that we often don't understand the value of it. And I assure you, this is not one of those webinars that you're not going to learn something. There are people suffering from hypertension or low blood pressure. As a professional, is going to be throwing a lot of light on this topic and doing a great justice to it while we wait for the DG to come in. Without further ado, we have Professor Kolawole Olubumi Ogundipe. He is the Chief Medical Director for the Federal Teaching Hospital, Ido, Ekiti. Professor Kolawole Ogundipe is a seasoned academic and healthcare executive with over 2 decades of distinguished service in clinical surgery, hospital administration, and medical education. Is the DG here? Hello, ma. Please, let's mute our devices. Elizabeth, please make me a co-host so I can mute people, please, to avoid the interference. Is the DG on the call now? Not yet. Okay,
Not
I'll
yet.
proceed. Okay, I'll proceed. Professor Kolawole, sincere apologies for the delay in starting. Thank you for your understanding. Professor Kolawole is a seasoned academic and healthcare executive with over 2 decades of distinguished service in clinical surgery, hospital administration, and medical education. A board certified consultant, plastic reconstructive, and aesthetic surgeon. Professor Ogundipe has previously served as Chief Medical Director of two other tertiary hospitals in Nigeria, Ekiti State University Teaching Hospital in Ado Ekiti and Afe Babalola University Multi-System Hospital Ado Ekiti. His leadership reflects strategic acumen in healthcare governance, patient safety, and institutional growth. He was a university scholar at the University of Ilorin, where he emerged as the best student in the first professional examination and was recognized as one of the two overall best students in his graduating class. His leadership journey includes serving as chairman of the Medical Association Ado Ekiti State Branch and currently as the chairman of the Strategic Synergy Group at Institute of Strategic Management of Nigeria, Chartered. Without further ado, I don't know if our DG is on the call so that I can call him before I bring in the guest. My chair, should I proceed to bring the guest
Please go ahead. Please go ahead.
So without further ado, first, let's celebrate Professor Kolawole. I'm sure is not that professor that you would hear him say the Nigerian time. It really does not exist. Can I get some emoji, some clapping emoji in the Zoom so that it can feel welcome? Because if we were live in a, thank you. You know, these are my people. Tracy, thank you for the emoji. Please, let's bring it up to encourage him to have the virtual experience and know that despite being virtual, it's not a boring. Thank you all for making it exciting. I see the love emoji. I see the clapping. Thank you. Thank you for making it amazing. Fantastic. Professor Kolawole Ogudipe, the virtual floor is yours. Thank you for a moment of a knowledge sharing. Thank you. The floor is yours, sir.
Yeah, thank you so much, dear Rotarian Mercy George Ibafe, and my regards to all the other Rotarians that are on the call tonight, this evening. I send my greetings to you from the city of Ado Ekiti, where I am, or no, actually in Ado Ekiti, where I am currently making the presentation for, even though I belong to the Akuwonjo Rotary Club of District 9111. It's a pleasure to be called upon this afternoon to lead this presentation on the hypertension, the silent killer that we must not ignore. I do hope that you can all hear me. I'm audible to everybody. Mercy, kindly confirm that everyone
can hear you perfectly, sir. We can hear you perfectly.
Okay. Okay, thank you so much. And as a subtopic to that is the request to people to know the number and know how to combat high blood pressure.
Please unmute, sir. Professor Kolawole.
Okay, so this discussion this evening we actually center on helping us to understand why hypertension is called the silent killer, and why as women, because I know quite a number of people on this call tonight are women. I know I'm speaking to the women in Rotary, and why as women must pay attention to the issue of hypertension and the blood pressure. We also try to explain what the numbers actually mean and how lifestyle choices influence the blood pressure that people present with. And as we rounding up, we talk about the practical ways to prevent complications and what Rotary women can do as advocates for healthier community. I know you have been doing so much in all other areas of life, and as I conclude this lecture tonight, this afternoon, we'll be looking at what Rotary women can actually do as serving as advocates. So let's start by looking at some similar clinical scenario that may help us understand clearly why we should pay attention to the issue of high blood pressure. And I will be presenting such 3 different clinical scenarios of issues that every one of us on the call can actually relate with. First is a 52-year-old woman who was a successful businesswoman, actually active and energetic, and is well noted for the various successes she's been making in business. She is someone that is considered very strong. In fact, she will pride to herself that she is strong and will never fall sick. Apparently, she has never been admitted in an hospital. So she goes by businesses without any worry, knowing fully well that she's fine and well. Had no cause to visit the hospital. But one morning, while getting prepared to go to work, the event struck when she had a sudden weakness on the right side of her body. She was also observed to have difficulty in speaking. Luckily, she wasn't alone. She was in a house where help could easily reach onto her. With the weakness on the right side of her body, obviously she cannot even walk by herself. But with the help available to get her, she was rushed to the hospital. And that is where the diagnosis was made, which basically shocked everyone. She had presented with massive stroke from uncontrolled hypertension. The blood pressure, when measured, recorded 220 over 130 milliliter of mercury. And to the amazement of everyone, they were surprised how could somebody who had never been sick, how someone who had no cause to visit the hospital, someone who has been going around with her business and she is quite successful at the business she's doing, could have such a high blood pressure. And but that was the diagnosis. The first time she would be noted to have issues bordering on high blood pressure was when she had a massive stroke from uncontrolled hypertension. The key message herein is that hypertension often gives no warning signs. And the first thing people may be experiencing arising from the effect of hypertension on them is that they may even have a stroke, just like this 52-year-old woman had. Fair enough if the stroke is such that can be managed and it doesn't result in death before help could come. For a number of other people, they might actually even be a heart failure that they will be presenting with. For some others, it's the kidney that has failed, and arising from the failed kidney, they are having challenges that portray that the kidney is failing. All these issues, whether it be stroke or heart failure or kidney failure, are things that are of grave concerns, and that if they do not get well managed, can lead to sudden death or a long-standing disease condition. Hello? Okay. The second case is that of a younger person, even a 45-year-old woman, a teacher, and a mother of 4. Sorry, can you help me those people who are talking in the background so that a 45-year, thank you,
yeah,
thank you, yeah, thank you. A 45-year-old mother, a teacher, has 4 children, and being a very dutiful and caring wife and mother, she was there for everyone, taking care of the needs of every other person, to the extent that she didn't even pay attention to the recurrent headaches and the fatigue that she had been having for several weeks ahead of that time. She often blamed the fatigue and the headache on the fact that, of course, she's stressed, being a mother of 4 who had to take care of 4 children, get them ready to school, and before she gets to go and to her own school, teach, get back and take care of the house. She blamed it on the stress, blamed it on the fact that she wasn't having adequate sleep, and that because so much need to be done at home in the home front that she might have been taking too much. That's why she has the headache and fatigue. And all seems to be going well. But luckily for her, at a routine outreach where some medical association had visited our school for a general outreach. And part of what they were doing was to offer every participant the opportunity to check their blood pressure. She was observed to have a blood pressure of 190 over 110 meter of mercury. Apparently, a very high blood pressure, and she was encouraged to actually go for some tests that can help understand how much damage the body had suffered from the effect of the high blood pressure. An early test showed that she had already started having features that suggest early kidney damage. The heart was already enlarged, and if issues is not nipping the bus at that point in time, the next thing that may actually have been happening to her may just be a heart failure or a kidney failure or even a sudden death. Remember the case of the 50-year-old woman we just talked about. So again, the key message here is that a lot of time people normalize symptoms that could actually be a pointer to the fact that things are not going right with the body. Because they normalize it and try to blame it on so many other issues, they delay in getting medical assistance. And it's important that even before symptoms start getting obvious, even before people start having headaches and they start having fatigue and other that may be, hypertension probably has silently damaged the brain, the kidney, the
Where's the
heart,
mommy?
even the eyes. Blood pressure, the blood vessels could also have been damaged to the extent that some of them, especially within the brain, can actually
Huh?
even rupture arising from the effect of the uncontrolled high blood pressure. So one should actually not ignore symptoms when one has gotten to the level that is already started having symptoms. And lastly, I'll be talking about this third case of a much younger lady, a 38-year-old, a young banker who is quite slim, very fashionable woman, and obviously she's used to exercising very well. She even visited the gym, and perfect. She thinks all seems okay with her. She had no time to go check her blood pressure because again, the assumption is that high blood pressure usually affects the old people or people who are much older, and that at 38, why should I need to bother myself? Why should I need to worry? At least I still exercise, and I'm young. I'm not thinking about anything. I have money and making some good money. But at work one day, calamity struck, and she went down in the office, suddenly collapsing, and had severe chest pain. People at work were able to help mobilize her to the hospital where she was resuscitated, and she was observed to have hypertensive heart disease. Her blood pressure was 180 over 150 meter of mercury with very, very irregular pulse and heart rate. So again, this is a young lady, 38-year-old, who seems to be exercising well. She's not even fat, she's slim, and having such a dangerous heartbeat with a very elevated blood pressure. And the key message again that hypertension is not a problem that affects only the old people. One does not have to wait that until I get to this particular age before I start paying attention to the figures, and then that I need to consider that hypertension is there. It actually can cause death silently without notice. And one does not have to be overweight. Being very slim does not rule out the fact that one can present with high blood pressure. So young, educated, active women can actually also be affected. So having noted the burden of blood pressure, which again affects so many people in the populace. The question we should ask ourselves is, what then is the blood pressure? The all along I've been talking about two different readings, the one over the other one. The blood pressure itself, in terms of definition, is the force with which blood, when it's being pushed around the body, is pushed against the wall of the blood vessels. Remember that the organ through which the blood is being pushed around the body are called the blood vessels. And the force with which the blood is pushed against the wall of those vessels is what gets recorded as the blood pressure. And there are two numbers. Example, 128, we talk about somebody who had 190 over 110, 180 over 105, another one that was having 220 over 120, and it could be in any format. The top number is referred to as the systolic blood pressure, and is the pressure when the heart pumps blood. Whereas the second number is, which is under, is called the diastolic blood pressure, and is the pressure that is recorded when the heart relaxes. When the instrument that is used in measuring blood pressure, called the sphygmomanometer, is used in taking the recording. The recording is taken in two forms, the systolic and the diastolic, and that is the number that presents as the blood pressure. What then seems to should be the accepted normal value. A normal value is less than 120 over 180. So somebody can have a recording of 120 over 75, that would be considered normal. Somebody can have a blood pressure of 105 over 70, is still also considered normal. And if it's 120 over 80, it's still also considered normal. And however, when the figures start getting higher than that, they can be categorized in various levels as elevated. There are some that are even hypertension stage 1, hypertension stage 2, and the one that becomes an hypertensive crisis, the level that have reached level of hypertensive crisis. I wouldn't know whether anyone of us has a counter situation where someone has gone to the hospital to go and visit a friend. And when get to the hospital, they just feel like, I have the opportunity to do, let me check my blood pressure too. They help to take the blood pressure, and after taking the blood pressure, the recording is so high that they say, you cannot go home again today, we are admitting you. A lot of people find it very difficult to accept. I'm normal now. I walk in here freely to come and greet a friend. I can't well go back home. I have not suffering from anything. Why then you now want to say you're admitting because of the blood pressure I'm having? If that person has a blood pressure of 100, over 180, over 120, the regular advice would be that we want to stop you and monitor you and ensure that we are able to control that and bring it down. So these are numbers that people should pay attention to. And let me just say this, and just for sake, and we will not bother about the other issues. Beyond knowing the numbers, there are other parameters that every woman should also try to get to know. Know the blood pressure, know the blood sugar level. You should be able to also know your weight, and having known the weight, be able to calculate what to call the body mass index. The body mass index actually uses the weight and the height to calculate what the body mass index is. And with a particular body mass index, one can tell whether one is normal, or underweight, overweight, or even obese, or even severely obese. Since these are not the subject for today, I will just mention that and drop that. Another very important figure people should know is the cholesterol level. All these actually play interchangeable roles in affecting one another, and it's important that as one gets to know their blood pressure, you're also familiar with those other ones. But having known that hypertension is something that can only be known by checking the blood pressure, we should understand further why it is important for us to check it. I've given the illustration of those three clinical cases, the clinical scenarios that I've painted. But let it be known that hypertension is a dangerous condition because it does not just affect a particular single organ, it affects so many organs in the body. It can affect the brain. You remember the case of that 52-year-old woman who had a stroke, it can actually impart on the memory and make someone to even not to remember things very well, have memory problem. There could be bleeding into the brain itself that may be very, very fatal. On the heart, it can cause virus, make the heart to beat in a irregular manner, causing all sorts of variations in the heartbeat. It can result in an heart failure, and it can even cause an heart attack to the extent that somebody who seems well may suddenly have a situation where the heart itself is deprived of adequate blood. And depriving the heart of that adequate blood will make that person to have either a transient ischemic attack, meaning a transient loss of blood flow to the heart, to the brain, or person can actually come down with some part of the heart cell itself getting injured and then dying off. There was even a particular incident where a group of doctors had previously visited my office, and they had a meeting, they were leaving, and as they were leaving, right within the hospital there, the admin building, one of them just suddenly collapsed. Help was nearby. The ambulance was mobilized, took him to the AIA, and on getting to the emergency department, he was diagnosed to have a myocardial infarction, which is actually a situation where some part of the heart is deprived of blood supply, arising from the effect of high blood pressure and other similar conditions. So again, the heart hypertension can come in various forms and can present itself in various manner. The kidneys are not also spared. They can have an kidney failure that can get to a level that the person affected will no longer be able to excrete waste product from their body, and they may require dialysis. And it can get so terribly bad from chronic kidney failure that beyond dialysis, there may be need to start contemplating the need for kidney transplant for such a person. On the eyes, it can cause blindness, and because there are also vessels within the eye, and all control high blood pressure there can almost result in blindness. The blood vessels can be ruptured at any point in time, whether it be in the abdomen, around the thorax, in the chest, or in the brain. When they rupture like that, and there's massive loss of blood, the effect is sudden death. So again, I appreciate the leadership of the Rotary for deeming it fit to request that people should understand why hypertension is such a silent killer, and requesting that people should know their number. Women in particular should know their number because they face some unique risk that men may even be protected from. A lot of women had their first challenge with high blood pressure when they are pregnant, and so many women actually develop hypertension that are related to pregnancy, whether when they are pregnant with the baby or a time after they have delivered. Pregnancy itself can induce hypertension, and that can present in a way that if it is not well taken care of and controlled, then it becomes a problem. The other problem challenge that women face is the issue of menopause. Uh, the stress body that our women bear is also unique and exceptional. There's no woman who will fold her hand and will not mind that her family, especially the children, have not been well taken care of. Even when men do not care about how to take care of the house, what the children should do, how to pay school fees and the rest, women always bear this burden. So they go beyond the level to be faced with stress that can make things not go so well. So because of that, women must pay attention to actually get to know their blood pressure. The caregiving responsibility, like I've just expressed, is enormous. And as part of that, a number of them present the delay in seeking health care because they are basically prioritizing their family over their self-care. They ignore routine checkups. When they present very late with complications. So I am pleading again from this call that women should pay close attention to their blood pressure. What are those things that can make one feel predisposed to actually having high blood pressure? I would say they are basically in two groups: the non-modifiable risk factors and the modifiable risk factors. When I talk about risk factors, we're actually talking about those conditions that, when present, may make one to be at higher risk of developing a problem than the other general population. So the non-modifiable factors is the issue of age. Naturally, with increasing age, the blood pressure also tends to increase. And that's why a number of times people that have had the impression that hypertension is a burden of the old elderly population. But it's important to note that while hypertension can occur in the very young, even in the teenagers, it is a non-modifiable risk is that issue of age, and that as the age increases, then one must also pay more closer attention to one's blood pressure. People who have family history of hypertension, probably maybe the mother is hypertensive or the father is hypertensive, as a young adult growing, they should also pay very close attention to their own blood pressure, because the risk is there that they themselves too may have high blood pressure. And if they are able to pick it up early, then it is fine. And for those where it, based on the gene that they have, they've been able to show that they possess the gene that predisposes them to high blood pressure. Those are things that we cannot modify. We cannot change anybody's age. We cannot request that people change their family after they have been born. And then we can't change people's genes. So there are risk factors that one need to know, but there are things that we cannot do anything about. However, there are several others that are even much more worrisome and can result in hypertension much more than these other ones that we can modify. We can modify the amount of salt that we take. So among the such risk factors is the excess salt intake, obesity, which is people being large, big, huge, physical inactivity, intake of alcohol, smoking, chronic stress, poor sleep, unhealthy diet. I'm sure practically all of us can relate with these factors that I have just highlighted there. Poor sleep is something that tends to affect so many people. It is expressed that the minimum amount of sleep required on daily basis for an adult is about 7 to 8 hours of sleep daily. I wonder how many of us are actually taking as much sleep on daily basis and having such good sleep. The issue of chronic stress, issue of alcohol intake, and want to say that there is no amount of alcohol that is taken that is beneficiary. So any intake of alcohol is actually enhancing the risk of a high blood pressure. The same thing with other factors, but let's look at some of them and see what we can do in actually be able to modify them. Such is that hidden enemy, and it is one factor that has been linked uncontrollably, unarguably rather, with high blood pressure. It has been shown that in communities where people take a high salt intake, many more of them actually come down with hypertension than in communities where people do not take as much salt. So if one is looking forward to actually staying away from this single factor that has the largest, present the highest risk for high blood pressure, we say stay away from salt. I know for a lot of us that may seem difficult, that we should stay away from salt. It's something that we want to advise that we should do, even if it appears as if it's a real burden. When we cook food, we should no longer add salt. So eat your food with no added salt. In the first instance, you may start reducing the salt gradually rather than stopping outrightly, because a lot of time people have complained that the food look bland when they're taking without salt. They do not even know what it tastes like. It's not palatable. It doesn't make them feel well. if one can control the tongue over time and see how the tongue adapts by gradually reducing that salt intake. While one is doing that, please be mindful too that there are so many other sources through which salt is hidden without one knowing. Seasoning cubes, Maggi, and the rest, they have high salt content. And if one say, okay, I've stopped taking salt and you now use Maggi in large quantity and number, you're actually bringing the salt back through other routes. A number of processed foods, fast foods, including meat pie and the like, have very high salt. There are some snacks too that are actually called salted snacks, salted biscuits and the rest. They are eating sources where sugar, where salt is can be found in large quantity, and where what one should actually try to see how to stay away from. The other issue is about stress, and I've noted earlier that women often are saddled with a lot of challenges that can actually portend a high level of emotional stress. There could also be financial pressure, especially when support is not there from the spouse. There are a lot of work-family balance that the challenge can result in an undue stress. Those undue stress uh, can, on their own itself, increase blood pressure. It can also affect the quality of sleep that one is having, and the sleep, again, like I said earlier on, is also people who have poor sleep are also at the risk of having high blood pressure. It could also encourage unhealthy eating. When one is not, going through stress, one may tend to eat snacks, junks, and things that are not so healthy. So, in a way, stress affects sleep, it affects the eating and habits, and then the blood pressure keeps going up. So, a number of healthy coping methods are available, one of which women in Rotary is already doing by being able to provide social support. Well, if one is going through challenge, then one can think that, I have friends in Rotary, they are my friends, they are my people, they are people where I can lean on, and they are even just a call across and they talk, those can be very relieving. So I encourage that the good relationship that has been seen among women in Rotary and other Rotarians generally should continue, because it's a very good way of coping with stress and taking care of one's blood pressure. I should also not fail to mention the need for one to have adequate rest, to exercise, and then to manage one's time in a way that will not put one under undue work-family balance. And to also note how to pray and meditate. If there are bodies that are much more than what friends and family.
Professor Kolawole, we lost you.
Is not enough to relieve the burden of high blood pressure. It's also good that people should not be involved in too much inactivity. So physical activities actually saves lives. And while doing this, aim for at least 30 minutes of exercise a day. The brisk walking, even at one's place of work, dancing. I saw a number of our friends at the last event in Abeokuta, and everyone was happy, dancing, jubilating, working, doing things together. Those are good ways through which one can actually enhance physical activities. For those who have gardens, they can go around their garden. It's also good exercise. And stair climbing, and then well, if we have short trips we want to make, rather than carrying the car, appropriate medicine for the body. And then when we eat, we should treat our food as if they are medicine. And I'm encouraging that we should and I'm encouraging that we should stay more on fruits, vegetables, beans, fish, rather than processed foods, rather than fried food, sugary drinks, and then excess red meat. if we treat food as medicine in that way, it will basically help us to also control those factors that can make the blood pressure go high. So note that in Nigeria, many adults actually have hypertension. Unfortunately, a very large percentage do not even know that they have it. Where some of them are people are diagnosed, they are given drug the first week, and they feel they are okay now. They stop taking the medication, throw it away because they feel that they feel fine, and they feel that if they don't have symptoms, everything is fine. For some people, they just even resort to herbal mixtures, which they think can cure the which they think can cure hypertension, and then that for other people too, once their BP normalizes, they stop taking drug. However, the truth is that hypertension usually requires long-term monitoring. It requires lifestyle modification and consistent treatment. And this is an important reality that we must bear in mind even as we get towards rounding up in today's discussion. So once again, it's important that we should not wait until we feel sick before we go and check our blood pressure. Do not be like that 52-year-old or the 45-year-old woman or 38-year banker who, at the first time they had challenge, they have information about their high blood pressure was when they were rushed to the hospital or when they had a routine outreach. Do not wait until you feel unwell before you check. I encourage every one of us on this call today to actually make attempt to check our blood pressure today or if possible tomorrow. Do not let's get to the next week before you check your blood pressure. And beyond checking the blood pressure regularly, we should also consider an annual medical screening, because I noted earlier on that it's not just the BP number that we need to know. We should know the number for the sugar level. We should know the number for the cholesterol level. We should know the number for your weight and height, and as it relates to other things. Feeling healthy does not always mean being healthy. So take the cue to actually step out and get care. For those who are diagnosed, if one is diagnosed, my advice is that you take the medication consistently. Do not stop because symptoms has improved. You should avoid self-medication from time to time. Do attend your follow-up appointments. Do not take it that your BP is now okay, and for 6 months, 1 year, you do not get back to the hospital to actually check yourself. Those who are on appointment to follow up their appointments really and ensure that they take the drugs that are given to them, not the one that their neighbor prescribed to them because the neighbor feel that that particular drug is working for him, and you think that, okay, now let me change to something else that my friend is benefiting from. If the blood pressure is controlled, it basically prevents complication. And all that, again, one need to preach hearing is that one should follow up with treatment and be compliant with the treatment. And lastly, as Rotary women, what can we do? You have done so excellently well in the management of polio, eradicating polio, and speaking to the people as to the need to ensure they get immunized, and in so many other aspects of medical conditions. You have been very strong advocate. So I'm also expect that you can take action in this regard. Today, we are seeing one of those actions in place. Women in Rotary are called for a discussion, a talk around hypertension, so that people can get to know their number and note that hypertension is a silent killer. Kindly organize more BP screening outreaches where people will have the opportunity of checking their BP, and those at risk can immediately be identified and encouraged to seek treatment. People should be encouraged to, especially women, to know their number. For every time you speak with a woman, please tell her, go and know your number. Back in those days when the challenge with sickle cell was a significant factor, when people meet and they are going to get along to their relationship, before they even ask their name, ask what's your genotype. So in the same vein too, for every woman you meet on the street now going forward, kindly ask, do you know your number? kindly go know your number if that person does not know it. Also help promote healthy lifestyle changes, support awareness campaign that can benefit the whole populace, educate families and communities, and so doing, we will be able to reduce the burden of neglected high blood pressure and the unwarranted complications we get from high blood pressure. For every woman that is well informed, an entire family is saved. And I'm sure that the Rotary can do this adequately well. Once again, I'll say thank you. And as I leave, these are important practical take-home messages that we should take away from this discussion this evening. Hypertension is common. It is much common than even what you can imagine. So it is important that we all know our blood pressure, and as that is ongoing too, we should reduce salt intake, exercise regularly, maintain healthy weight, manage stress, take medications faithfully for those who are already on drug, and encourage others to get checked. I want to say thank you for listening to me this evening, and I look forward to hearing your feedback. As many people die from hypertension complications because many people die from hypertension complications not because treatment does not exist, but because they did not know, they delay, they ignore the number. The best time to check your blood pressure is today. And I do hope that I have the assurance of everyone on this call that if they have not checked their blood pressure before and they do not know the number, they will go and do that today. Know your number and save your life. Thank you and God bless.
Know
Thank
your
you. Over
number.
to you, Madam Mercy.
Know your number and save your life. I don't know if the DG is here. Know your number and save your life. Wow. Wow. Know your number and save your life. I want to hear in the comments, what are some of our takeaways? What have you learned about hypertension? First, I think let's get some clap emoji. Let's get some clap emojis in the chat. I want to get some clap emojis. He has said to us, women in Rotary, we are doing something fantastic. I have a question here. I'm going to get to the question shortly. Okay. Know your numbers and save your life. Husbands, if you are here, tell your wives to go and check their BP. Okay, it's important. And he said women in Rotary are doing something fantastic in terms of creating awareness around hypertension. I'd like to read in the comments, what are our takeaways? Professor Ogutikwe, there's a question here. How does one reverse protein in urine and low heart rate, which has occurred as a result of hypertension? That's question number one. But I'd like to read some of the thoughts. Nobody's calling me in the live webinar. Okay, so informative. Thank you, Professor. I want to know, what are your takeaways? Know your number and save your life. Thank you, Innocent. Nice presentation. Okay, everybody is hounding on know your numbers. I think that's the mantra that we can go with. Know your number, hypertension, know your number and save your life. What are the other takeaways that we have taken away? Prof, would you like to answer that question? I don't know if the DG is on the call at the moment. I don't know if the DG is here. Okay, she can unmute. Okay, somebody's asking me to unmute. Okay, my chair, please unmute yourself. Everybody can unmute. I sent you a request to unmute yourself. Thank you for that WhatsApp message. Okay.
Thank you.
My chair. Okay. I'd like to bring our chair up. I don't know if the DG is here. Does anybody have any questions before the chair takes over? Does anybody have any questions? First, I would like to say a thank you to our guest and bring on the chair for women in Rotary to speak. Okay, I see avoid self-medication and medication from friends. That's a question. That's a feedback. Fantastic. Professor Ogudipe was a fantastic presentation. You have a question, sir, before I bring our chair on. How does one reverse protein in urine and low heart rate, which has occurred as a result of hypertension? Prof.
Yeah, thank you so much, and I want to appreciate everyone for those warm gestures you've expressed after the discussion. First, we must understand, why do people have protein in urine when they have high blood pressure? The protein in urine should not normally be there, and it gets there when the kidney is also damaged as a result of high blood pressure. You know, I told you earlier on that one of the organs that can get damaged arising from high blood pressure is the kidney. When the kidneys are damaged, it allows protein that should normally be conserved in the body to be expressed in the urine. And for women who are pregnant, the feature of having protein in urine and high blood pressure is referred to even as preeclampsia, a condition that could result in the baby not growing very well and can become a surgical obstetrical emergency, resulting in early childbirth and even death of the woman who is carrying the pregnancy. The protein in urine will remain until the injury of the kidney is reversed. And what to then do to eliminate the protein in urine is to manage the blood pressure appropriately to the level that it can no longer cause ongoing injury on the kidney. The previous one on the kidney will heal over time, and then the protein will stop being passed in urine. So to reverse protein in urine basically is to address the high blood pressure that actually led to that high protein in the urine. The same thing goes with low blood pressure. I think he said low blood pressure. A low blood pressure need not to be reversed if it's a healthy, if it's in a healthy range. And what one should really applaud is that one's blood pressure is low and not high. So if somebody has a low blood pressure, it is safer to just keep it at that. However, if it becomes too low to a level that one seems to worry about, then one should visit the doctor and let the doctor examine the person and, and check other part of the body to see if that low blood pressure actually has any negative consequence. I don't think I do hope that I have addressed the question as asked. Thank you. Over to you.
Indeed,
Okay,
sir.
okay, okay,
You
okay.
did
She
justice.
said low heart rate, not low blood pressure. The normal heart rate is from 60 to 100. So anyone who has a heart rate of 60 to up to 100 or 99 is considered normal. So even if the heart rate is 60, is normal, and one should not worry. Even if 62 is also normal and nothing to be worried about. However, even if and when it's less than 60, it should not be taken in isolation. One will consider it in relation to other conditions that may make such happen. If it's 110, it should also not be taken in isolation, because if somebody suddenly see a snake rolling around one leg, the heart rate to jump beyond 100. So if you check around that time, the heart rate going to 110 may not be considered abnormal, but it should return back to normal. So it's the low heart rate will not be taken in isolation, but bear in mind that normal rate is from 60 to 100 beats per minute. Thank you.
Thank you, sir. I would like to call on the chairman to give some of our remarks before we call it a session. I know normally we do something here at Women in Rotary, there where you have a Zoom networking session. I want to appeal to you guys. Many people always take it for granted, but once we start, they will start rushing to say, oh, the time is too short. So if you can wait after the chairman speech, we'll create a networking session virtually, and you can meet one person from this meeting. Thank you. Without further ado, my chair, the floor is yours, ma'am.
Thank you very much, Rotary and MGI. Thank you so much for your wonderful education on hypertension today. I do hope our women and men, because not only women that are on this platform, we have some men who are not even Rotarians. We have women who are not Rotarians, whom we invited on this platform to come and listen to you. Sir, my own question is, it's not even a question, is how to advise us on the use of our medication. You see, when some people, I as a nurse by profession, I've encountered a lot of patients who will say, the drugs I'm taking, there are too many. The doctor said I should be taking my antihypertensive drugs every day. But I took it on Monday. I'll take another one on Friday. Sir, can you please expatiate further on that so that people will understand better? That, they should listen to their doctor's advice and prescriptions, sir. Thank you.
Thank you so much, TIG. And I must say that you've made very worthy contributions with regard to that. And a lot of us need to be well oriented on how to really listen to our doctor. There are no two individuals that are the same. What works for Lara may not work for Mercy, and what works for Mercy may not work for Kolawole. We are all different individuals. And before our doctor will prescribe our medication, they will have considered the medication that is best suited for our age, for our race, for our body size, and for other possible comorbidities that they have also observed in us. So those drugs are actually personalized to the person concerned. And it's not something, like I said earlier on, that one would say, Madam Titilayo uses this particular drug, her blood pressure has been normal, she's not going to hospital. Let me just copy and paste that and be using the same thing. Or get somebody and say, okay, I do not have my own drug with me. Which drug do you have? You start taking that. The drugs are different sizes, different types, and they have to be taken in a different way. So depending on what has been prescribed, there are some that are best taken in the morning, some that are best taken in the night. There are some that may require that one take it in the morning and at night. And for most of them, there are drugs that we require that we take daily. So one of the ways in which you can remind ourselves so that we do not forget is to maintain a particular daily routine. If we take the drug at if we take at 8 o'clock in the morning, let's take it regularly at that 8 a.m. One can actually set an alarm on one's phone to remind one to take the drug. For those that are supposed to be taken at night, one can also choose a particular time that one will know that at this point in time, usually I'm free, I can access my drug and I can take it. And one should not, because I feel okay today, I then skip Tuesday, Wednesday, Thursday, I'll go and take on Friday again. That will not allow the blood pressure to be monitored and regularized effectively. And it may be difficult for the doctors to be able to work with you and be able to know the best dose that should be adequate. So I'll also join you in encouraging all our women and men alike that they should be very compliant with their doctor's prescription. And if they are confused, they should refer to their doctor to seek clarifications on what to do with their medication. Thank you.
Thank
you
you
very
so
much,
much,
sir.
Okay, over to you.
And my moderator, please. Another thing I would like our doctor to please expatiate further on is what best time is it for us to take our medication? Morning or the evening time, sir?
Thank you, Ma. There is no single best time for all the various drugs that are available. There are some drugs, depending on what is prescribed, that are best taken in the morning. There are some that are best taken at night. And let me just use a particular medication as a reference. For those who might be on diuretics are those drugs that make one to pass more urine. and it helps control blood pressure by reducing the total volume of fluid within the heart space and ensuring that there's just adequate volume of blood in the body. So those drugs that are called diuretic that can actually make one to pass urine quite a lot, what we recommend that they are best taken in the morning, because if they are taken at night, it will wake one up to go to toilet much more often, and that can actually disturb sleep. So for that particular type of drug, it might be best taken in the morning. There are others that they can moderate and help control drug, help also make one relax and can help induce sleep. Those are better taken at night rather than taken in the morning, because if they're taken in the morning, the person who is taking it feels a little bit drowsy at work or even while doing other things. But when taken at night, the drowsiness, if and when it happens, will basically aid sleep. So one should clarify with their doctors which drug they are being given and what time is best suited for those medications. Thank you.
Thank you very much, sir. I would like to throw this to the platform. Anybody that has any other question for our prof to please say. I also want to acknowledge the presence of our own Professor Femi Oloyede. He's been here on the platform from the onset of this program. Thank you very much, Rotarian Professor Oloyede. Do you have anything to add to what Professor Ogundipe has said?
No.
My chair, there's a question from Teresa.
Chair, I was trying to unmute myself.
Okay.
I want to thank you most sincerely, my brother, Professor Ogundipe, for the wonderful lecture. I align myself completely with all that you have said. And again, just like my chairman has said, the women and the men, by extension, in Rotary and beyond, cannot thank you enough for this wonderful men you served us this evening. Again, just for the record and emphasis, we must avoid just taking drugs that others have been given simply because they were using it. I've seen a lot that they went to the chemist and to ask the chemist man, I have high blood pressure, give me medications. It's quite a lot, and they kept not working until they have a complication like stroke or kidney problems, which never linked to the error in the prescription. So we have a lot of, most of the people who are in the renal unit today, we were told they actually have high blood pressure for so many years, not properly diagnosed, not properly treated before they got into renal units, with dialysis and all the rest. So please, let's take this home. That lack of proper diagnosis, copying medications or using unprescribed medications, very dangerous to our health. Not only the blood pressure, but other conditions like kidney failure that we have in our environment. Thank you so much, my chair, for inviting me.
Thank you, Professor Femi Oloyede. Thank you so much, sir. So any other person have anything to say, please? Our wonderful Professor Ogundipe, please.
Dr. Kayode Akinlade is raising his hand.
Okay, please go ahead, sir.
Thank you very much. Thank you very much, Madam Chairman, and women in Rotary, organizers and members. Kayode Akinlade of the Rotary Club of Akowonjo. I joined a little bit late. I'm sorry about that. I'd like to thank again, as many people have done, Professor Kolawole Ogundipe for the beautiful lecture. And I'm sure in the introduction, I must have been introduced as a member of the Achievers Club, the Rotary Club of Akowonjo. Thank you so much. One comment I need to add is that I would like to encourage as many members in this group and even outside this group to try, endeavor to have a blood pressure machine at home. Not only because you may be hypertensive, but to propagate the gospel of having blood pressure checked for everybody that you come across. For example, you may come across visitors coming to you complaining of headache suddenly or whatever. You just bring out your machine from your house and check the BP of that person. As you have been told, high blood pressure does not have any warning, it's a silent killer. It may be an opportunity for that particular person to discover that he or she is hypertensive. So I encourage everybody to please endeavor to have a machine at home for the use of not only yourself, your husband, indeed every member of the family and your friends, so that together we all join hands in checking this menace of high blood pressure that is ravaging our society. Thank you very much.
Thank you very much, sir. You can hear Dr. Akinlade, he has said it all. We should all endeavor to get a set of BP machine. The prices have come down in the market. You can get a good one for around 40, 45,000, 50,000 naira that you can keep beside your bed. You can measure your BP first thing in the morning and have a book by the side of your bed to record it there. And last thing before going to bed, then this you take to your doctor anytime you have a doctor's appointment so that it can be monitored. For everybody that has spoken this evening, I want to say a very big thank you for all our participants. All of you are wonderful. Thank you so much. I can see my chief of staff. I can see the past chief of staff too, Professor Kola Wole Oguntipe. Thank you so very much. We will call on you another time to talk about another topic. And I can see that Dr. Akinlade is hyping their club. That is RC Akunwojo. Thank you very much, RC Akunwojo, for producing a Rotarian like Professor Ogundipe. Thank you so much. We appreciate you all. God bless you. I know that now we are going into I don't know what MGI usually
No, my
call it.
chair, there's a question.
Okay, let's go ahead, please. Okay.
So that will be the last question. Professor Ogundipo, Trisha is asking, do the risk you mentioned apply to hypertension too?
Please come again, please.
Does the risk I iterated earlier apply to hypertension?
They actually offer hypertension. I talk about risk factors that can actually enhance the potential of developing high blood pressure. And I said there are two different categories, the unmodifiable and the modifiable ones. All of those ones that I mentioned are actually risk for developing high blood pressure. I've shared the slides on the district platform, and I'm sure we can seize the opportunity for those who have missed any part of the previous presentation, they can catch up with what was missed here. So all the factors that I mentioned are actually risk factors for developing hypertension. Thank you.
Okay, sir. Thank you so much.
Thank you so much, sir.
Okay.
I also want to let the people of this platform.
Do you want to say any other thing?
I want to let every one of us on this platform know that once you are having headache, your headaches are persistent or comes once in a while, please check your BP and consult your doctor, please. It's important. Thank you very much. At this junction, I want to say a big thank you to everyone from me, my dad, Rotarian Henrietta Otuko, Rotarian Laura, our own Rotarian Fatima, Azan, the Queen on boarded, Dr. Olukayode Akinlade of RC Akomojo, the Ativas Club, everybody on this. Oh, my sister is here from Canada. Umiri Miloko, thank you for joining. Rotary Balogun, Rotary Maureen, thank you, Rotary Maureen. Rotary Arike, thank you so much. Akim Sumono, Rotary PG, thank you so much. And our own very Folashade, Folashade Kasim, Dr. Akisanya, that's my husband, is also on this platform. Thank you all for being part of this wonderful Rotary Chinedu Ebu. Thank you very much, sir. Rotary Emmanuel, thank you. You are well appreciated. And it's quite inspiring when you call for a program like this, and a lot of people keying into it. You know, we don't learn everything per day. You learn, but Professor has been able to give us a very good lecture, coupled with other doctors that chipped in their own. I want to say thank you and God bless you all. Rotarian Philip Ebosele, I'm sorry if you are not a Rotarian and I'm calling you. Rotarian Angela, thank you. Rotarian Francis, thank you. Rotarian Grace, Rotarian Lady Akosa, Rotarian Tony Suraliu, Vivian, thank you. Our past DES, Chomoye, thank you. Sandra, thank you. Rotarian Silva, Egi Silva, Teresa, thank you. Udim Jonah, thank you. United President of Akomojo, thank you very much. Lieutenant Tokwe Ifebanjo and Sibel Fatima. Thank you. Everybody has a word. So we see each other again at the next webinar. I just lost a very close friend just this afternoon, and I'm there now. So I would like to take my leave. On behalf of the district governor, I want to say thank you to you all. God bless you. Until we see another time. Thank you. Bye.
Thank you, everyone. Do you still want to network? Can I just get comments? If you're interested in networking, virtual networking, I can set that up. Just type networking, otherwise we'll close the meeting. However,
no, just please go ahead, please. Go ahead.
Okay. I'm not getting responses. Prof, please don't go. Let somebody get to meet you beyond you being a facilitator. Are we networking? I can't see comments. Are we interested in networking? Okay, I'm saying thank you.
I was actually going to seek for the permission of everyone to go so that I can. I'm still in the office. I need to attend to a number of other issues that I've kept waiting.
I don't think they're interested in networking, sir. I don't think they're interested.
Thank you
so thank you so much, sir.
Thank you so much. I appreciate everyone.
My chair, thank you. And Rotary and Sylvia, thanks for your kind comments. I appreciate it. Have a good evening, everyone.
Thank you.
And Chair, sorry for your loss. Thank you.
Sorry for your loss, Chair.